Hello and welcome back to the Heal with Grace podcast. I have Howard Schubiner here, and I'm really excited to have you. Thank you so much for joining. This is going to be a really special episode.
Thank you. Special, we shall see.
So, why don't you give us just a little bit of an introduction as to your background and how did you come into understanding or really working in the mind and body field for chronic symptoms?
Yeah, it's hard to know. Kierkegaard said life is only lived forward, but you can only understand it backwards.
Mm.
And I think about that a lot because I think about my history going back to my college days when I was interested in mind-body medicine back then. And starting to work in a free people's clinic in college and starting to question like what medicine was about and what it was doing. I mean, back then we had a pamphlet called Billions for Band-Aids. It was a critique of the medical system. And now, of course, it's trillions for Band-Aids. But I've learned over the years that modern medicine is good for some things, actually.
Yes.
And people have made, we have made, actually, we in the sense of medicine has made strides in helping people with heart disease and cancers and diabetes, and there's a lot of and HIV/AIDS and infections. There's a lot of treatments over the past 50 years that have revolutionized treatment, and a lot of those diseases that kill people are getting better in a lot of ways, actually. On the other hand, the diseases that don't kill people are getting worse. And it's really striking when you look at it that way. So the diseases that don't kill people are chronic pain. And so there's 1.5 billion people worldwide with chronic pain. We're talking about, just in the US, 50 to 75 million. We're talking about in the US, 25 million with migraine, 30 million with irritable bowel syndrome, other headache pains, pelvic pain syndrome. Modern medicine is not doing very well for those. They're increasing. The treatments are becoming more invasive and less effective. And the same is true for anxiety and depression, which are increasing in society over the last couple of decades. Treatments are not getting better. Chronic fatigue, all the syndromes associated with chronic fatigue and dizziness and tinnitus, increasing in society. And modern medicine has no real answers for that. So it's a huge divide. And I got into it, I guess I should answer your question. I got into it 22 years ago by reading a book that Dr. Sarno wrote, The Mind-Body Prescription. And someone just said, hey, Howard, you should read that book. I was a mindfulness meditation teacher at the time. And I read the book and I said, that is interesting. I used to think about these things a lot back when I was in college, but my medical career had taken a lot of detours and done a lot of different things. But I'd done a lot of research and I'd done a lot of teaching and I'd done a lot of practice, and I'd prepared myself in a lot of ways for this work, unbeknownst to me. And I called up Dr. Sarno. I worked with him for a while, came back to my hospital, and I said, I want to open a little clinic and see people with these chronic, non-specific functional type disorders and see if Dr. Sarno's methods actually work for me. And they said, fine, go ahead. And I did. And they did. And it's been a journey, and since then it's been doing research, writing, teaching, organizing. It's been quite a journey, and it's been incredible looking back at it.
Yeah. It sounds like it. It sounds right. You've taken lots of turns, but it sounds like there was always something about the way that you looked at people and medicine and disease, or like chronic and non-chronic disease, that always made you question. So yeah, it was kind of it was something
Yeah, I
natural.
think to some degree. And I think what's really changed, I mean, I was brought up in the biopsychosocial model as a young doctor. And we were on the forefront. I worked with great people who taught really importance of patient-doctor communication and caring for the patient and all that. I learned that from when I was starting in medicine. But I gotta say, Grace, that this work requires doing that at a higher level. It's really been interesting to me to see, to really, because when you do this work, you're not doing 15 minutes, you're not doing half an hour visits. I was doing an hour and a half visits, 2 hour visits. I was learning about people's whole lives. And when you look at people's whole lives, I mean, you see amazing things that I was like, what? How can this possibly be so amazing? The journeys that the people that I was seeing had. And when you look at their childhood issues that they had, the ways they learned to treat themselves or not treat themselves, the trauma they had from the medical profession, the trauma they had from all the symptoms that they had, which kept piling up more and more. And, I needed to up my game as a
Mm.
doctor to really understand that and listen to that and hear that. And really, and I don't know, there's no better other way to say it other than to say I had to be way more compassionate and caring and understanding of people than I had been in the past. And that was a big shift for me.
I know firsthand, and I know many people listening to this know that's not normally the case when people go and see doctors for their symptoms. And like you mentioned, there's trauma that comes from just having chronic pain and illness and trying to figure it out and going years without understanding it. And so for you to say that, yeah, there does need to be an immense amount of compassion and care and education around what's actually happening, right? Coming from a
Yeah,
doctor, that says a lot. It's really
right.
important.
And, having the skills of a doctor was really helpful, actually,
I'm sure.
because I could cut through some of the crap and some of the inaccuracies that people were getting from
Mm.
traditional doctors about their back MRIs, about their genetics of what they supposedly had, about the inflammation they supposedly had. I could cut through, again, some of the inaccuracies that they were getting from some alternative medicine practitioners that were inaccurate, medically speaking. So that was really helpful to be able to have those skills, because I can't tell you how many times I saw a lady. It's kind of a funny story. We were talking about EAET a little bit ago, but I saw this woman who was like, you know what, the back MRI you have is really normal. It's the doctor's telling you that there's these abnormal findings, but those are normal abnormal findings. They're not actually the cause of your pain. And we've proved that based on how your pain shifts and moves, turns on and off, all these things, right? So she said, I know, but I can't get that image out of my mind, that doctor telling me how, how messed up my spine is. And he's showing me, here it is right here. See this, see all these things. I can't get that out of my mind. I can't feel safe in my body. I can't separate from my pain. I can't do that kind of work because I've got that thing. I said to her, I said, what if if you were back in that doctor's office right now and he was telling you all this stuff, but you knew it was lies? You knew it was inaccurate. What would you say to him? This is like amazing, right? And she's like, yeah, what would I say to him? Like, what are you telling me? She starts yelling at him, right? In her mind, she's yelling at him, don't say this to me. This is ridiculous. Get out. You should lose your license, you know? Like she just pushes him away and walks out of there. And I go, how does that feel? She goes, that feels great. And I go, well, what do you think about the MRI now? She goes, yeah, it doesn't bother me anymore. I
I
was
love
like,
that.
this is amazing.
That is
But yeah, it's like medical trauma. I can't tell you how many times I've had to apologize for my brethren, in the medical profession for not knowing. And how many times have you had a client or a patient say to you, how come no one ever told me about this before?
all the time. All the time.
Right? I mean, how come no one told me?
Can
Yeah.
you
So
back up for
you
a
lead.
minute? Yeah, so can you back up for a minute to talk about what do you mean by abnormal abnormalities? Wait, normal abnormalities. And
Yeah.
to help our listeners understand exactly what you mean when someone does come in with certain findings, whether it's in their spine, whether it's
Yeah.
inflammation, whatever it is.
Yeah. No, I mean, if you have chronic pain in your head, your scalp, and your neck, and you go to a doctor and they say, well, your hair's turning gray. They say you've got wrinkles. They say your skin's a little saggy. You go, yeah, but I'm only 25 or I'm only 40 or whatever. How can, and other people have these findings. I know that other people have gray hair and don't have headaches. I know other people have wrinkles and don't have face pain. I know other people have saggy skin and don't have neck pain or back pain, right? So, but that's exactly what doctors are telling people. They're telling people, well, your MRI shows degenerative disc disease. But what they don't tell you is that healthy people with no pain also have degenerative disc disease. You have bulging disc. They're not telling you that healthy people with no pain also have bulging disc, right? And it's the same thing with gut biome or inflammation in the fascia. It's like, these are things that are, I don't know. The problem is that there's a stigma against a mind-body condition. There's a stigma against people telling people that it's all in your head. Well, of course there is, because if you tell people it's all in your head, you're diminishing them, you're belittling them, you're demeaning them, you're gaslighting them, right? It's horrible. So we would never do that. And we have to be honest about what is happening, that the symptoms are real. That's what I was talking about, validating people, loving people. If the people I see don't think I love them, why would they even listen to me? If they don't think I care, why would they listen to me? So that's got to come first. And we have to be accurate in saying that real symptoms can occur because of the brain. And we can talk about how the brain works a little bit, maybe, because I think it's really important for people to understand that. Um, so the normal abnormalities basically mean that two things. One, correlation is not causation. This is a cornerstone of medical practice. Just because something occurs, they say, well, your inflammatory markers are high and you have pain, but that doesn't mean that you have pain because of the inflammation. You may have high inflammatory markers because of a virus, because of stress, because of trauma. And when the pain goes away, the inflammatory markers don't change. So then we know that it's not actually the inflammatory markers causing the pain. So its correlation does not equal causation. And when a doctor tells you that something is responsible for your pain or anxiety or depression or fatigue or dizziness or whatever, if those findings are also seen in normal people without symptoms, then that should make one pause. So that's what I mean by these, quote, normal abnormalities. Dr. Sarno talked about that back in the 1970s and 80s. It's not a new concept.
It's not, but actually, as you were talking about that, I'm wondering, since you've been in this field for so long, since I'm talking with Dr. Sarno around it, that book is, by the way, the first book I read too, The Mind Body Prescription, about 10 years ago. And I grasped it, but still was, struggling a little bit to understand it. I was also 23 or something like that, and in grad school actually for therapy. And no one talks about this in my program or anywhere, right? So I had no idea what was going on. And so there's more therapies like pain reprocessing therapy, EAT coming out more recently. What was going on between 20 years ago and, I don't know, 10, 15 maybe years ago?
Hmm.
Or sorry, 5 to 10 years ago, I guess. But what
Yeah,
was going on in
yeah.
that gap?
I think that, I mean, from what the way I understand it, I mean, many people are working in different ways at the same time and coming to the same conclusions. And this has happened for centuries in
Yeah.
science. I mean, Darwin came up with the theory of evolution, but another person across the world came up with the same theory at the same time. So these things happen all the time. But I think Dr. Sarno really kind of dominated the field for quite a while, and most of the people doing the work had learned from him and were using his model, which was a very specific model that he laid out in his books, which was great, and it helped a ton of people. And over the last 10, 20 years, a bunch of second wave, third wave people, whatever, started trying to, improve, started trying to look at some of the mechanisms. Why does this work? How does this work? What should we do it this way or that way? And we started to do research. And so Dr. Sarno didn't have the opportunity to do a lot of research. And so when you start to do research, you have to kind of manualize your programs.
Hmm.
Because when you write up a scientific article, you say, well, what did you do? Well, we did X, Y, and Z. And so through that kind of those processes, we developed these, and I think of it as three things basically. One is the pain reprocessing therapy group that I call the symptom reappraisal therapies. And I put all these under what we're now calling neuroplastic recovery therapies. So the umbrella term we're using is neuroplastic recovery therapies because neuroplastic seems to be one of the best descriptors of what these symptoms are or these conditions are because they come from the brain and the brain is neuroplastic. The brain can create them. The brain can turn them on. The brain can turn them off. They're real. They're not imaginary. They're not fake. They're not people's fault. And they're not caused by tissue damage in the body. So you put all that together, you get a neuroplastic symptom. So neuroplastic recovery therapies, I think of pain reprocessing therapies, symptom reappraisal, lowering fear around the symptom and rewiring the neural circuits from that point of view. Then I think about emotional processing type therapies. EAET is the one Mark Lumley and I developed, emotional awareness and expression therapy, but there are others. It's not the only one. EMDR, expressive writing and journaling are other ways of getting at emotional processing. There's a lot of other therapies, somatic experiencing, internal family systems, etc., lightning process. So there's a lot of other ways of getting at that. And then there's that other category that I like to think about, which has to do with how people treat themselves. Who are you? What do you need to change in your life, if anything? You have to change who you are, where you work, who you live with, how you treat people, how you treat yourself, how you care for yourself, etc. That area can be really critical. So those are the three kind of categories of therapy that I think about that I think we've been relatively successful in formalizing those, naming those, manualizing those, and helping people use those.
Yeah.
I don't know. What do you think?
I agree. I like the distinction of those three ways and types of therapies because you're right. We very much so need all of them. I think that at least how I work with clients is I try to see where they are and meet them where they are, right? How much information do they have? Where are they in their journey? And also just, what's present in their life. But I do find that the work starting with understanding and with the brain sometimes can be a little bit maybe more of an open door,
Yeah, yeah, right.
right?
Well, before doing the therapies, the first two steps are explaining how the brain works, explaining neuroplasticity, explaining predictive processing, which we can talk about, and the assessment, making sure that there's not a structural problem that needs specific medical treatment or there's some combination of neuroplastic condition plus structural. But, I've worked in this field for a long time. And the vast majority of people with chronic painful symptoms do not have tissue damage in the body. The vast majority of people with chronic anxiety and depression and chronic fatigue syndromes and dizziness and tinnitus and all the other kind of chronic ones, if they had a structural problem to cause it, usually it's going to be found within a few weeks, a few months, a few years. People have had lots of medical attention for the most part. It's rare to find a significant structural problem that's been missed. So these neuroplastic conditions are incredibly common, but the assessment needs to be there. People can't have confidence that they don't have a structural problem unless they've had a decent assessment, obviously.
What would you say? How would you explain to someone what's going on when let me back up. There's many times where I have people come to me and they're like, I've done therapy for years, never worked, never changed anything. And I didn't even know I've had chronic pain forever. I've had these symptoms forever and I've been to therapy. It didn't work. What's the difference between doing other types of emotional therapies and then coming to this work?
The main reasons that the standard psychotherapies for chronic pain and anxiety and depression, it's not that they never work. Obviously, they have been found to be effective. It's just that in general, the effectiveness is relatively small and tends to wane over time. And it's not because those therapies are bad. And the therapies I'm talking about, by and large, are cognitive behavioral therapies, acceptance and commitment therapies, mindfulness-based therapies. And as I said before, I've been a mindfulness teacher for over 25 years now. Everyone should learn mindfulness. However, the three things that are missing from those, number one is the assessment. If you don't have an assessment of what the problem is, then the psychotherapy is actually more of a coping model. It's helping people to cope with the illness that they have rather than helping them to reverse it. And so if you don't have the assessment, you can be mindful. If you're mindful about your back pain and you presume, as everybody would, that their back pain is due to structural damage in the body, it may vary over time. You may cope with it better, but it's unlikely to go away just by being mindful of it. If you're mindful of your thoughts, that's a different thing, because you know your thoughts are coming from your brain, and you know your brain is neuroplastic. You know your brain has all sorts of thoughts. I mean, when I learned mindfulness from John Kabat-Zinn and Saki Santorelli back in 1999, the most liberating thing was like, thoughts are just thoughts. That was a liberating statement. What if the back pain is a thought? If the back pain or the headache or the irritable bowel or the anxiety or the depression or the fatigue is actually a thought, in other words, something generated by the brain that is changeable, that's a whole different ballgame. So if there's no assessment, those therapies are limited. And therefore the treatment is geared toward coping with them better as opposed to reversing them. And the third thing is those therapies often, not always, but often are less geared toward addressing emotional conflicts, less geared toward addressing anger, guilt, shame, grief, moving into those and through those to get to compassion, basically. So those are the reasons that we've come up.
Yeah. And when you're talking about this assessment, can you describe what it would mean when someone goes through an assessment and you would found that they're neuroplastic symptoms or they have neuroplastic symptoms?
Yeah, there's 3 steps to the assessment. The first step is ruling out a structural problem. That's usually been done through going to regular doctors, routine visits. If the diagnosis they come up with is degenerative disc disease, if the diagnosis is fibromyalgia, if the diagnosis is irritable bowel, migraine headache, tension headache, pudendal neuralgia, if the diagnosis is vulvodynia, coccydynia, those diagnoses are implying that they actually haven't found a significant structural. And most of the time, that's not difficult to do. That's the first step. Rule out a structural problem. Step 2, rule in a neuroplastic symptom or condition. How do you do that? Well, there's 2 parts to that, I think of it, and I've written about this a lot. One is the circumstantial evidence. You know, if somebody comes in your house and they're wet, you can assume it's raining outside, but maybe they ran through a sprinkler. That's circumstantial evidence. So circumstantial evidence is like, well, they had childhood trauma. Well, people with childhood trauma have higher rates of having these conditions. But not all people with childhood trauma have these conditions. In fact, it's a minority. A lot of people have childhood trauma, but also have childhood protective events. Another thing that's circumstantial evidence is linkage. Well, the symptoms started at a time of stress. It started at a time of major issues going on in my life. Well, they could be coincidental, but it suggests that it might be related. The third thing is that the person who's presenting now with, say stomach pain had a history of migraine when they were a kid, and then they had a history of pelvic pain before. They had a history of anxiety, had a history of depression. The other conditions make it more likely. And then people who have pain in lots of different areas. Those are circumstantial things which add up. Oh, and the personality traits, like people who are hard on themselves, people who are overly perfectionistic, put themselves last, have a hard time being kind and caring to themselves. Those kinds of things are really important, but they're not confirmatory that it is a neuroplastic condition. So the final step is confirm a neuroplastic condition. And again, I've written about this a lot, and what I call the fit criteria. things that are functional, inconsistent, and triggered. So if the symptoms are functional, that means that there's no structural thing to account for them. If it's pain that's in a wide area, it occurred without any injury, it's lasting much longer than an injury would have healed. It's also, so it's functional inconsistent, means the pain is varying. It can be bad in the morning, better at night, vice versa, goes away when you're on vacation, shifts in different places in the body. That's inconsistent. And then triggered by innocuous stimuli, triggered by the wind, triggered by stress, triggered by cold, triggered by heat, triggered by the weather, triggered by a computer screen. And so when you put all those together, you almost always get a very clear evidence to get to what I like to call a click moment. One of my favorite stories is a guy, it's horrible, 25 years of horrible pain, can't sit down, and then he got foot pain, can't stand up, can't sit down. 25 years, going to major medical centers, super great medical centers, injections, medications, surgery, nothing has helped. And he's basically becoming uh, not wheelchair bound, recliner bound and suicidal, 25 years. And somebody says, hey, watch a podcast, watch a video about mind body work. So he watches it. He goes, that's interesting. I wonder if that applies to me. So a week later, he's walking into a pharmacy and his pain is like a 5 level. And he walks into the door and he sees a long line to wait in. And within 10 seconds, his pain is a 9. And he goes, okay, I got it. I see it. That was his click moment. Yeah. And it just took that one moment. He had an idea, he understood it, but he now knew it applied to him 100%. And within a month or 6 weeks, his pain was gone. 25 years. Because he changed his understanding of it. He changed how he treated himself. He changed how much he walked, and even he started walking, but he was in pain, but he didn't care, but he was able to keep going because he knew it was reversible. And that assessment, that click moment, and I've got 100 stories about different click moments, but I think people do better when they look for those, when they find those, and it's worth the time. So somebody say, I want to know now. Well, let's just keep waiting. Just keep watching, see what happens. Let's understand this so we really know. When you really know, it can make a huge difference.
Yeah. It's that, I like that term click moment. I usually say aha moment. It's a therapy term, I think, too. But yeah, when that happens, then you can start to understand that when not only how I treat myself, but also how my body feels really is direct, not necessarily just a correlation, but is actually happening from maybe how I'm treating myself, what's around me, what's happening, right? That doesn't make sense for it to be a structural issue. It doesn't make sense to just all of a sudden be in a line and be afraid of the fact that it's 9 people long and then all of a sudden your body feels pain.
Yeah,
So,
exactly.
yeah.
I got an email yesterday from a woman, a patient of mine, who had something came up in a situation in her life, and it was annoying or difficult in some way. And she started to get these symptoms in her body. Started to get tightness, started to get heaviness, started to get these weird sensations in her body. And she stopped and she said, I wonder what's underneath that. And she said, what is underneath that? Because this just happened. I mean, my body didn't change. Something happened. And she said, oh, well, this situation happened. Oh, well, how do I feel about this situation? Actually, I'm annoyed. I have resentment. Actually, I'm angry about it. And so instead of saying, is what she had done for decades, was just push all the anger down, push her feelings down, put up with everything, to be good, to be nice to everybody except herself. She said, no, I'm really angry about this. And that's why I'm having these sensations. Oh, click moment. I get it. And then she can do something about it. And she chose to have a conversation about it. Wow. Stand up for yourself. Say something. Be civil, be kind, but be honest. Be authentic. Symptoms went away. She said, I have a superpower. That was amazing.
Mm-hmm. Yeah. So how does emotional trauma, childhood trauma, or even if some people don't understand exactly the trauma, how does that increase pain, inflammation? Like what's actually happening there in the brain and the body?
Yeah. So the brain is an amazing device. It has memory and remembers everything, but it doesn't remember everything in the videotape manner. It remembers emotional content. And it's trying to keep us safe, to protect us. So if you learn that people in your life don't pay attention to you or neglect you or don't hear you, you sort of start to learn not to say anything or not to rock the boat or to try super hard to win praise. If you learn that people will betray you, maybe you learn not to get close to people. If you so the emotional learning that happens in all children have emotional hurts. All people have emotional hurts. And if they have protective people around them who are caring and loving, they can learn you can get emotionally hurt and you can be okay. So that's resilience that is built in people. On the other hand, if the protective factors aren't there quite as much, people learn that things are going to go bad for them. And their brain starts to act to send them messages. So the brain is a predictive processing machine, which means it creates what we experience. We see with our brain. Light comes in our eyes, but the images that are created are formed in our brain. You can see in your sleep. You don't need your eyes to sleep. You can see in your sleep, dreaming. What we hear is created by our brain, and what we feel is created by our brain. When you touch a hot stove, it's not your finger causing pain. It's actually your brain, which is weird. And the reason we know that simply is because people can have an injury and have no pain at all. If that can happen, it shows your brain is in control of the sensations we feel. And it turns out that so you can have an injury and have no pain. You can have pain in the complete absence of an injury, and everyone knows that. When you put those two together, and then you take the third fact is that emotional upset causes the same parts of the brain to activate as does a physical injury. This is amazing, and this has been shown in several studies. When people are given emotional content, their brain creates an activity pattern which is similar to be having a physical injury. Are you with me?
With you, just keep going. It's just my camera,
Okay.
but audio
Yeah.
is good.
Okay. Yeah. I was
Sorry, I
afraid.
don't know why. Yeah, go ahead.
And so what we know now is that when pain occurs, it's generated by the brain. When anxiety, fatigue, depression occurs, it's generated by the brain. And it can be generated by the brain in the presence of physical injury. Certain things can cause those conditions, but most of the time, as I said, it's generated in the absence of physical injury. It's generated by stress and emotions. So the danger mechanism, the alarm mechanism that people have in people who have childhood trauma, it's more likely that they have had sensitized danger and alarm signal, which then is more likely to be activated by later life stressful situations.
Okay. Sorry about that. All right.
That's all right. We might have to back up a little.
Yes, just a little bit because we got it cut off pretty early. I mean, not early, sorry. Like it stopped when we cut off. So, okay. Apologies for that.
So where should we
So let's
go
start
from?
with the last thing I remember was brain has the same parts of the brain are lit up with
Right,
emotional
right,
hurts, right? As
right. So, right. So we know that you can have an injury and have no pain at all. You can have pain or other symptoms and have no injury at all. And then the third fact that's really mind blowing is that emotional content, stress and emotions, cause the brain to activate the same exact patterns as does a physical injury. So when someone gets an emotional injury and they get physical pain, it's real pain. It's the same pain as if they had a physical injury. It's exactly the same. So all pain is real. All pain is generated by the brain. And these are revolutionary concepts. And pain that's neuroplastic is reversible. And most chronic pain is neuroplastic and is therefore potentially reversible. And that is just, it's just mind blowing. And most people don't know that. Most doctors don't know that.
No. Even that statement, when you say emotional pain lights up the same parts of the brain as a structural pain, right, in the body, that I remember that
Yeah.
to me was an aha moment of, "Ooh, it clicks. It makes sense.
Yeah.
Okay. I can
Yeah.
grasp onto that. I can understand that." Yeah.
And so childhood trauma, and everyone has some, of course, as I said, causes the brain to remember those kinds of traumatic events. And the brain learns and remembers that. And then when later life situations occur that are similar to that, so one of my first patients I saw had headaches for 17 years, horrible pain, many headache clinics, nobody could help her, every day, headache pain, every day, 17 years. And her pain started at a time when she got a new boss, and her new boss was unpredictable, would go into fits of rage and yelling. And it turned out her father was exactly the same way. And that was mind blowing to me. I'm like, wait, your father treated you that way, and now your boss is treating you that way, and that's when your headache started, right then? How simple is that? How straightforward is that? What am I, Freud? I mean, it's not that. Nobody had ever asked her those questions. Nobody had ever asked her about that. And it was right there to see if you just ask. And that was the key for understanding, oh, that's why these headaches started. And that was the key to getting her on the path to getting better. So this idea that the brain creates what we experience is really powerful. And the brain is sending us a message. It just doesn't speak English. It might be in the form of neck pain or stomach pain or dizziness or anxiety or fatigue. That's the messenger, but what's the message? Does it have to do with what's going on in your life? Does it have to do with what's happened earlier in your life that's coming back to haunt you? Is it because of how you're treating yourself? I mean, there's so many things to learn from, but I mean, the beauty of this work is that you can grow from it, right? You can learn something really important about your life and yourself. And I was saying about that woman who, for the first time in her life, said, wait a minute, I'm not honoring myself. I can choose a different path. And that is a growth experience, not just to get rid of her pain, but to grow as a person and to prevent future episodes
Mhm.
of neuroplastic symptoms, by the way.
Yeah. It really is an amazing growth opportunity. It makes you I mean, when you come to this work, your body's forcing you to look at what's going on in your life, in your past. Some people come to this work in different ways or self-development work in different ways. But this is really, it kind of makes us look there and you can grow from it. And it's an incredible journey. It can be hard and difficult, but it's also can be really amazing to see that and be with the growth that can happen from and come from it.
Yeah, I mean, we rarely lead with, oh, you know what? Your pain is really a gift. It's like, no, I don't want to hear that. No, no, it's not a gift. But if the brain is a danger signal, if the brain is there to protect you, guide you, help you in a way, warn you, alert you, it's alerting you about something. And if you can figure out what it's alerting you about, that can be a key.
This has been an amazing conversation because I think this is going to be super, super helpful to break down what's happening, how it's treated, and really give people a clear idea of what's going on. And if you're listening and you've been questioning it, I hope this gives you maybe a little clarity, at least to just move forward. So I guess I'll ask you this. Someone listening who is starting to grasp onto this or they're questioning and maybe they're like, maybe this is for me. What would their next step or their first step look like? What would you suggest?
Well, there's so many great resources to educate yourself by. There's so many great podcasts, So many great interviews out there, videos, movies. I mean, there's once you get into this space, drink it up. Just learn. And then once you've learned that, you're opening your mind to a possibility. And that's the first step. Just open your mind to a possibility. And then the next step is to, well, now let's see, does it apply to me? How might this apply to me? Start taking stock of your life, putting it down in order, in chronological order. What happened? How might these pieces fit together? Are the symptoms coming and going, turning on and off? Looking at the fit criteria, looking at the evidence, putting the doctor's reports together, and just kind of taking a whole viewpoint and getting help if you need it to figure it out. But the most important thing is to just keep an open mind and then look and evaluate the evidence. And when you do that, 95% of the time, it's right there. It's right there.
Where can people learn more about what you're doing right now? Do you want to share a couple announcements?
Well, I work for Comendi Health, John Strax, my good buddy. I see patients there virtually. I work for the ATNS, the Association for the Treatment of Neuroplastic Symptoms, our nonprofit. We have a big, exciting conference coming up in Boulder, Colorado, somewhere you're near and dear to your heart,
Mm-hmm.
at the end of September. That's symptomatic. My website is unlearningyourpain.com. And I'm writing a new book for Random House. It's coming out next year, which I'm excited about. And there's an opportunity for people, if they've benefited from this work and want to put their name on a list that's going to be in the next book, they can go to my website and put their name in, or a fictional name if they prefer.
Amazing. Thank you. And I'll have all the links linked below. So if you want to learn more, you can do so through those links. And is there anything else that's come to mind? I'm sure there's a lot because we could talk for a very long time about this, but I always like to ask, is there anything that's come up for you that we have not talked about that you feel like is really important for our listeners to know?
I think that it's useful to understand that these conditions are really human conditions. We're human beings. Everybody has mind-body conditions in some way, shape, or form. They may not recognize it, but everybody does. Because we're human beings, we're social beings, we're in connection to each other, and these connections often fray or get broken. Young people are seeing these connections fray and get broken at much higher levels in the last decade or so. And it's important to remember that we're emotional beings, and our emotional needs are really important. We have emotional needs to connect to other people. We have emotional needs to be assertive and be our own person. We have emotional needs to be honest and have integrity with ourselves. And those things are just part of being human. Everybody has those. And we can't do this alone. You can't be a human being alone. Loneliness is really bad for people, it
Hmm.
turns out.
Yeah.
So I think the thing that's really important to understand is how can we find connections with ourselves and find connections with others that are fulfilling and caring, and not so much of the world is polarizing and it makes it hard. So I think that human connection issue is something that is just really important.
I'll highlight that too, especially for, if you've been dealing with chronic pain, illness, symptoms for at any time, but especially for a long time. Most people, I know I have in my journey with it, have felt really alone and isolated because no one understood me. No one grasped it. Doctors couldn't help me. My family didn't understand it. People around me didn't get it. Right. And so that can even just feel even more isolating, and
Yeah.
it's really hard to go through. And so when coming to this work, like you said, this is a whole new world. There's a lot of community here, and it's really wonderful. It's why I created a group for this, for people, to help people so we can connect in a group way. I think that, yeah, thank you for saying that because it's a really important part of this process. Yeah.
Well, thank you for doing what you're doing, Grace. I appreciate it.
Yeah. Appreciate you and all of your work and all the trainings I've done through you. So thank you.
Cool.
Yeah. All right. We will talk to you all soon.
Okay. Take care, everyone.